John, it's all yours. Oh, hold on.
This has to do with how we handle life and how it is that we handle what we think about, our personality. Is it getting better or worse? Are we affected by other people? What we think about, our memories. I have a much more extensive bit of information on this. It's kind of a very favorite subject of mine. And it's very revealing. So hopefully you'll get the point from this. Like this brings out how in the world can a massive tissue with the consistency of a raw egg be called our brain? It only weighs about 3 pounds. It's small enough to fit in your hand, but absolutely fantastic. I want you to think about yourself, if you will, and how you relate to what you're going to see. Because what you think is what you become. If you can't control your thoughts, then you can't control your life. So the bottom line is what? It's change your thinking and you will change your life. Let's think about that for a moment. Our mind, our brain. Here's the question, are they the same? Give yourself an answer, if you will. Do you think that they're the same? Okay, some said yes, some said no. Think about it. We have our body. What effect do our emotions have on our brain? Or is it the brain and the emotions? Or is it the mind and the brain and the emotions? What answer do you have? All you are, no matter how you look, whatever your age, with your old black, white, or whatever, this is what you are. Are they the same, the mind and the brain? Well, think about it. The mind is what the brain does. This is a diagram here showing the effect of the hypothalamus and the pituitary gland. We're not going to go into that, but this little gland in the center of your head controls so many functions. I've done a considerable amount of research on this, and it's overlooked for the most part by the medical community. You're usually diagnosed with a thyroid problem when the real problem is upline. It's in the pituitary. And very seldom are you checked for the pituitary and its condition. It's in the middle of your head, middle of your brain. Or is it the middle of your mind? All right. So we look at the world today. There's a lot of good people out there. They're trying to do good. But sometimes they really do stupid or bad things and they don't know why. Where's this all coming from? Is it the mind that's affecting the body and the emotions? Which one is it? How do they interact? Have you even thought about that? Are you an emotional person? And if you are, or not, is it your brain directing you or your mind? Because the emotions are the reaction from either or one of those or both. Sometimes stuff just happens, but you can still be in control. Why do some people say this? Have you ever said that? Here's another very, very important question. Do people ever make you happy? Do people make you sad? As you can see in the bottom picture there, can people make you mad? Somebody pulls out in front of you when they see you there in the automobile and your emotions rise. Did that person make you mad? No. They can't make you do anything. You do it to yourself. If you let other people make you glad, sad, or mad, then they're controlling you because you're letting them take control. But really, that's not happening. You're in control. If people make you mad, if they make you glad or sad, they don't have the power to do that. They're just acting. They're producing a certain type of action. It's you that is allowing yourself to either be glad, sad, or mad. Let's look at this again. You have problems with thoughts reoccurring. They just keep coming back, whirlpooling. What am I going to do? What am I going to do? You can't get it out of your head. How does that happen? Is our brain hardwired? We think about it. That's an impressive bit of information, isn't it? That 100 bits of information pour into our brain every second. And this is in the form of electrical impulses. Our thinking then is because of electrical synapses in our brain, and that directs how we feel, what we say, and really how we live. See, if you let those things affect you, it's a constant fight. Sometimes people will get married and the woman will say, well, I can change him. He's a nice man. He's got some flaws, but I can change him. Or it's vice versa. And of course, that's 100% erroneous. You can't change yourself most of the time, let alone changing someone else. The brain's very, very complicated. Scientists are constantly examining it. But we're going back to our original question. Does the brain and the mind always work together? We look at a couple of photographs here of the brain and the matter of serotonin, a good thing. Excuse me. Look at the difference when a person is depressed and when they're in good mental order. There's ignitions in the brain. They can actually light up according to some of the new technology. So is it possible for the hardwiring of the brain to overpower what the mind wants to do or know what it should? This is a very serious question because it doesn't matter who we are. We've all got this same situation. We have our brain, have our mind, all saying, what should I do? Okay, the brain says, I'm hungry. The mind says, it remembers, oh yes, food tastes good, I want food. The body's waiting to react. The mouth starts salivating, the stomach rumbles, it becomes nervous. Now, the point about this is, in this case, because of being hungry, the brain overpowered the mind because all of these things are happening. The mouth, the stomach, you become nervous, agitated, ready to have some of that kielbasa and cabbage and potatoes that you see on the table there. Here's another situation. The brain says, I'm sleepy. The mind says, well, I want to stay up and watch that late show. And there you have the late show with your host that's there. What's going to happen to the body the next day? Person's going to say, well, I'm tired, I'm sleepy, I'm short-tempered. Well, what happened here? You have the interaction of the brain and the mind. One wants to do one thing and the other wants to do the other. So in this case, the mind wanted to see a TV show. It overpowered the brain, and you suffer the consequences the next day. There's another situation. The mind says, there's a snake. The brain says, "Its snake is bad. It may bite. It may be poison. Run, run, run." Well, the body now is reacting immediately. The heart rate increases, the breathing increases, the muscles tighten. Now here, what you see is the brain and the mind are working together. So you see, you have that potential for both of them to work together. Let's look at another common situation. Man or woman, the mind says, there's a handsome man or a pretty woman. The brain says, yes, it is. What do you want me to do? I really want to look some more. The mind says, all right, I'll put other thoughts aside and let you concentrate. The mind says, I really shouldn't stare because I'm married and I should stop. Now the brain, it gets a little confused here and it says, what do you want me to do? I'm getting involved now. And the mind says, yeah, I know, I'm getting aroused. Now the body here is going to react out of control. Or you can take action to stop the cycle. See, the point is, it's up to you. See, in this case, the brain and the mind work together, but the end result is up to you. What decision you make, because it is a fight. You think about that. It is a fight. Letting other people and other things affect you. We talk about emotions, bad memories, low self-esteem, fear, resentment, anger, sadness. Can you relate to any of these? Do you find that you have anxiety or bad memories? Do you have grief because perhaps the loss of a loved one? Can you control your grief? Is it out of control? Is it the mind or the brain? Are they working together? What does the depression cause? You know, what's interesting about all of these emotions is they connect to organs in the body. These emotions connect to muscles in the body. These emotions connect to the endocrine glands in the body. They connect to your eyes, they connect to your teeth, and a multiplicity of other things. So if a person has constant depression or sadness, and they cannot change it, they choose not to have the self-control or do something to break out of that mold, then other things are going to happen. And the thing is all of these things here are not the result of a deficiency of some prescription drug. It's all within your brain. It can affect your personality and trigger what you do and say. And we've got so much going on in our mind. And the point is our body is not pieces or parts, it's all connected. One thing affects another. In fact, one of the scientific articles indicated that every cell in your body is aware of what's going on with the other 100 trillion cells that's in your body. It's aware of the health. That's how your immune system kicks in. That's why you have digestive problems, why you have pressure in form of anxiety or depression, indigestion, things of that nature. And so it affects the muscles, the joints, organs of the body. And you may not have thought about that, but what you think affects all the body. And you know how it's going to show up? In the weakest link. And you know what that link is called? The name of a disease. So whether your brain overpowers your mind or conscience allow you to make good decisions, you are still responsible for what you do. Think about it. See, whether you're happy or sad doesn't depend on other people, what they say or don't say, how they respond to you or not, what you have or what you don't have. It depends on you. And that's not just a face you put on. That will affect your body. Now, I've shown this particular idea to many, many people, and most people don't get it. That applies to somebody else. But let's look at that again. Let's repeat it. If whether you're happy or sad does not depend on other people. It's not what they say or don't say, how they respond to you or not. It depends on you. It is your choice. People do not, or things or situations do not have the power to make you feel happy, sad, or glad. It's just a situation. It's your choice as to how you're going to handle it. So do you recognize what your brain or mind is doing to you or for you? And here's the underlying thought. If you change your thinking, you're going to change your life. And that's a universal law. Here's another reason. How you think, how you feel, how you react affects our entire body. The whole body, our pain levels. People can make themselves hurt. People can kill themselves. When we worked in the clinic with Dr. Clark, we saw people who could not get over their situation, and they had the best of health care. Their body was doing well, but they literally killed themselves because they could not control their thoughts. They let a situation affect them to the point of where their body deteriorated from the mind on down to muscles, heart, lungs, liver, spleen. You can throw your spine out of alignment with what you think. You can definitely, as you probably will agree with, mess up your digestive tract. No, I'm too upset, I can't eat. And it'll affect other aspects of your life too. So, friends, how you react to life, what you do may affect yourself and others very little, or it may affect your everlasting destiny. And by an act of will, you can make yourself do what is right. It's up to you. If you change your thinking, you will change your life. So this is this first portion. I thank you for viewing this. But what was the point of our discussion? If you had to tell someone who's not online right now, you saw something rather interesting, how would you sum that up in just a couple sentences or so? Okay. I hope you think about that. Any comments, briefly? No comments?
Everybody's unmuted.
Yes.
Okay.
I have a question.
Okay.
The pituitary gland puts out all these hormones. Is cortisol one of them?
Is what?
Is cortisol one of the hormones that the pituitary gland puts out?
You have a lot, you know, I have an entire program on that. Perhaps Dr. Mike does too. The answer to your question involves a period of other hormones and connections. We're just trying to trigger your thoughts as to controlling your thoughts. Cortisol, yes, is involved here. Hey, we've got more to go on here. Another quick question. Who am I looking at here? Okay.
And that's a good question, and we will continue to look at that question. And as it relates to your adrenal glands, I'll be covering that actually the next time we meet here, which will be in a couple weeks. And I'll have a notice out. I'll be covering the adrenal glands and microcurrent, and then how I treat issues with the adrenal glands, because they are a big part of what we deal with in our everyday stress. I'll let John continue, but just a quick, just a quick insertion here. I think the adrenals are playing into what we're dealing with more now than ever before, and we're seeing the result of that with a lot of issues with depression, suicide, mental health, significant changes because of this COVID-19. The adrenal glands are really taking a beating, and we'll talk about cortisol and all of that. But as like John said, we'll get to that at another time soon.
Thanks.
Okay, John.
Okay, let's go to this next thing. I think you'll appreciate it here. What do we got here? Share screen. What's happening?
Are you able to find it, John?
Yeah, do you not see it?
No, not yet.
Oh, okay. Okay, hold on. I have it up. I'm just off of Zoom now. How about now? Can you see that?
No.
Oh boy. Okay.
You should have the, I've given you the ability to share the screen. It should
Yeah, well,
syndicate it on my control here.
somehow I lost what I had up here from
Oh,
before.
okay.
Someone else goes on there. Well, I'm sorry, folks.
No, it's all right. Just a reminder again to everyone, on Wednesday nights, every other Wednesday night, I have a Dr. Streeter, who's a medical doctor, a very well-known medical doctor in the United States, in his work in using natural therapy for healing all types of health problems. He and I have worked together for the last 30 years. He's the medical director for the Amish communities in Michigan and Indiana, and Dr. Streeter and I do a health segment every other Wednesday at 8 o'clock. We'll be back on, we did one last Wednesday, so we won't be on tomorrow. We'll be on the following Wednesday again, but I'll get an email out to everyone again. And to remind you of the upcoming segment with Dr. Streeter and I. Any luck, John?
Well, I can bring it up here on my presentation, but it's not coming up there. I'm not getting it on the share screen.
How about, let me try something. Hold on. Okay, how about now? think you might have it now. Hold on. No. Let's see.
I'm up on my screen. I don't know how we can get it onto Zoom. And this is the one I wanted to show too, because it's the last one I'll do for a while.
Oh. How about now? I tried to switch it over to another thing again on this.
Yeah, it was up. I had both of them up before and something happened. It got torpedoed.
Okay.
Sorry about that, folks.
Hmm.
Let me try something here. Copy it. No, I don't want that. Okay. I don't know what's happening here.
Okay.
I've got all things happening on this computer here. All right. Here we go.
Got it?
Is it up?
Yes, it is.
Okay, great. Okay, so we've done about 4 or 5 of these presentations, and everyone that's on this evening probably has not been on throughout the last month and a half history of what we're doing. So we're going to review a couple of things that tries to encourage you to be the best you can. We've used microcurrent, seen the results, and so we want to review some of these. Of course, we're talking about the clinic in the case or the clinic in the pocket. This at one time was a prescription device, and depending on what you say it does, it still is, but it's also available for home health care and individuals. It is FDA listed. It's the most effective healthcare instruments in the world. I've shown you many, many ways, dozens and dozens of ways over the last month as to how to use them. And it's way beyond pain control. As you can see, you can use multiple aspects of how to treat people, from hands-on to non-attended therapy. You can do all kinds of lymphatic draining and body detoxifying. You can treat catastrophic problems. You can do it yourself, or you can do it to others, or have others do it to you. Some of these, if you've been on this Zoom meeting before, you'll recognize this. And this is a result of the effectiveness of 6 weeks of treatments on microcurrent. It increases your energy, less tiredness. That doesn't mean you're going to be skipping rope 3 hours a day or walking up a mountain. But the point is it will optimize what you have left to be the best you can be, with energy, less tiredness, stamina, better sleep, rarely sick, clearly thinking. Another bit of research has to do with what we were talking about before, the ability to control our anxiety and depression. And this was on 327 patients. This work was done. and they compared the effectiveness of prescription pills with its effect on being in control and not having to be on anti-anxiety symptoms. And you can see the popular ones are very low compared to weekly treatings with microcurrent called cranial electrical stimulation, or CES. There's no side effects with this. There are side effects with these. We've reviewed all the things that the clinic in a case can do. The 3 major programs that deal with literally hundreds of thousands of problems, and we've categorized it in these 3 programs here. We've gone over the some of the research, and we have a plethora of it, really, of the difference between milliamperage and microamperage treatments. Most people get a TENS unit, and you go to the doctor even, and you'll try to tell him what you've been doing and why you feel better, and he'll say, yeah, I know all about that. And he thinks it's a TENS unit. It is not. TENS stands for transcutaneous, or through the skin, electrical neural stimulation. Microcurrent stands for microelectrical neural stimulation. And the 99% of all instruments that everybody uses on their patients for pain control, and it does work for pain control, actually brings down ATP as much as 50% below normal. Cell membrane transport, it actually shuts down the wall of the cell 30 to 40% in getting nutrients into the cell. So a person has to ask themselves, if they're using it for pain, can I afford this to have less cell energy and have nutrients blocked on a cellular level? You can see protein synthesis. Again, down. Microcurrent, on the other hand, this article that appeared in Clinical Orthopedics, a very prestigious peer review, showed the difference between the two. And this is very upsetting to people who have the TENS units, because they say, well, no, it can't do that. It handles the pain, yes. How often do you use it? Well, on and on and on and on. Now they're implanting them in a person to have a constant override, or what Melzick and Wall, a couple of researchers, said, a noxious influence that influences the pain level. And the other thing is, this was very much disputed, because it's very disturbing, because 99% of all the instruments that everybody uses is a TENS unit, whether it's a big tabletop unit or one you hook on your belt or one you put in under your skin. So down to Medical University of South Miami back years ago, they said, we cannot accept this. We don't believe it. Well, they did their own research and came up with the same information, but because they were overly critical, they really helped us all understand it, because it also, they proved that microcurrent can increase fibroblastic activity, DNA synthesis, the most important thing that's going to determine your health, T lymphocyte activation, your immune system, insulin binding, dealing with sugar problems, calcium channel opening. So they came up with all of the, over the last few weeks, we've gone over this. We've explained this page. If you want this page to review, email me and I'll be glad to send it to you, because there's a big difference. Again, go to the doctor, try to explain your unit. Yeah. I know exactly what it is. And there's a 99% probability they have no idea. We did this to a little girl, 42 years old, in 43, out of Orlando. She had breast cancer. She'd been on chemotherapy for 2.5 years. She had just treated herself with 2 milliamp devices, got in the car, came to my office in Ormond, and I did a test on her. Now, these 2 milliamp devices had good frequencies because they were called Rife machines. And that's another subject. But the right frequencies work. The problem is they're all milliamp devices. So if you're strong enough to withstand the killing or the weakening of the good along with the bad, that sounds like chemotherapy, doesn't it? Then it'll fix you. It'll make you better. But most people are not. So here a person comes in, they're using these wonderful frequencies. And remember, this girl had just treated herself about an hour and a half, 2 hours before with these instruments. These are all the organs: the lymph, the lung, the colon, circulation, endocrine system, the heart, small intestine, spleen, pancreas, liver, stomach, gallbladder, kidney, and the gonads. And this is how this test came up. Well, this is the normal area here. We gave her a 15-minute foot-to-foot treatment. And that's how she came up. Now, you might say, well, was that an electronic aspirin? No, it wasn't, because she was good for over 2 weeks. Now, the thing is because she was on chemotherapy, she insisted on following the direction of the medical profession and stay on chemotherapy. What she did say is my energy was much, much better, and I did not have the nausea for 3.5 days after I get a chemotherapy treatment like I did before. We've got thousands. I've done over 30,000 of these tests before and after, and I know the difference. I see the difference in what happens to people. So anyway, folks, I hope you found this helpful, what we've done in the last few weeks. But we also showed you some other suggestions, things that you don't even have to have an instrument to do. Here's some from last week. If you weren't here last week, then this will be new to you. If you were here, we got some questions for you. 12 ways to help your lymphatic system. One is by breathing, water, lemon water, walking and moving, rebounding, inversion table, foods, enzymes, adjustments in massage, herbs, body brushing. If you were here last week and we did this together, you can do it now. You can press on these. You're milking your lymphatic system. One of the new diseases just came up the last day or two. Bubonic plague is coming back. 2 people died in China on that. Other countries like Peru, for example, is another country where bubonic plague is sticking its ugly head out. And you know what it does? It affects the lymphatic system. So, every one of those things will not cure you, but they help your lymphatic system. We went over those in detail last week. Here's my question. If you were here last week, have you done any of those? I don't want an answer here. You have to answer to yourself. If you did any of the 12 things that was suggested, did you do it every day, once, not at all? Yes, no. Remember, the schematic is you have life, the body, how you care for it, and it's you, it's not the doctor. Remember, you can pay a doctor $1,000 a day like Mikey did. He still died. He's not responsible for your health. He's just a coach. So here's another review. Last week, acid foods that make you hurt. We went in detail on that. Foods that'll make you better. It'll help balance the acid-alkaline situation. But here's the question, friends. Did you download and print the alkaline acid chart to balance your body? Remember, that was a suggestion. You can go on there and you get a foods to eat, food not to eat. If you did it, that's great. If not, I don't know what to say, because all the advice in the world will never help you until you help yourself. Here's another review. Did Remember, we showed you the most important, the most powerful acupuncture point, and it works. Here's a question. If you were here last week, have you done it on yourself? If you did, how many times? Each day, once, not at all? If you've treated yourself, how did it make you feel? If not, are you feeling that good? In the last week, we showed you some things you can do that just put your feet or hands on it. And have you done any more since last week? Again, we're making the point. It's your life, your body. How you treat it, you're going to be good or bad health-wise. We'd like to quickly go over this. It's called the vagus nerve, and it has with the mind-body connection. It's a gut-brain superhighway. It's the longest nerve in the body. It's in the brain. It goes all the way down through the body, the longest nerve. Why is it important? Because it connects to all vital organs. The longest nerve in the body. Can you imagine something like this affecting all of that? It's called the vagus nerve. Passes in that area of the body. As you can see, it's emanating out of this superior aspect there. It goes through the lungs, through the heart. Low vagal tone is associated with heart problems, strokes, depression, diabetes, chronic fatigue syndrome, rheumatoid arthritis, all of these problems, low vagal tone. Okay, is there anything we can do to stimulate that, to keep it going? Is the result of a low vagal tone or activity that's depressing all the healing and balancing aspects of your body? Is it the result of a deficiency of prescription pills? No, something's wrong in the body, and you can stimulate those. On the other hand, you can help your blood sugar if you stimulate that area. You can reduce the risk of other problems, as you can see. It'll put you in a better mood. It can help arthritis. All of these things, these potential symptoms could be the result of low vagal tone. 90% of the vagal nerves send instructions from the brain to the stomach. Did we say 90? Now let's look at that again. The brain controls 20%, but the gut or the intestines control 80%. There's a feedback mechanism. Here's what the medical community wants to do. They want to put a stimulator under your skin, and the approximate cost is $20,000. I think that's gone up a little bit here in the last year. So they open you up and put this in, and it's this little buzz. Guess what kind of a device that is? Here's an acupuncturist can help you. It can stimulate it, and this is what he would do. You can't really do that to yourself. And how long will it last? There are some units out there that they're not microcurrent, and they can stimulate the vagus nerve. That's a good thing. But remember, milliamp therapy lowers your energy on a cellular level by as much as 50%, blocks absorption, slows healing. I mean, can your health afford this? There are devices that you can put on your body, and again, they're TENS units. Do they stimulate it and activate the vagus nerve? Yes, they do. That's a good thing, but it's temporary. And again, what kind of a health condition does a person come in with if they have their energy lowered, blocks absorption, slows healing, and so on? Here's something you can do right now. Okay, do this right now. Go ahead. Hold your neck firmly. Bend your head forward 3 to 4 seconds. Couple of deep breaths. Okay, go back normal. Did you feel anything happening? You might have felt some vertebrae giving way in your spine. You've just activated your vagus nerve. So whenever you're feeling low, maybe in a bad mood or bad energy or heart palpitations, you can do that. It's 3, 4, 5 seconds. Here's some other ways you can do it. Now this is from researchers. They say if you breathe slow with your belly going in and out, that'll stimulate it. Yes, humming, speaking, washing your face. I've got information on that. It's funny, but it's true. Meditation, all of these things can stimulate your vagus nerve. Balancing your gut bacteria. And of course, if you have a clinic in a case or clinic in a pocket, here's some areas that you can make a real difference. The others that you've seen really do work, friends, but they're temporary. How temporary? Everybody's different. Here's where you can access those points. Right behind your ear, as you can see, and we have a model here that's stimulating hers with the BMW that's part of the clinic in the case. So let's do that right now. Reach behind your ear. Feel the bone behind your ear in the little depression. Rub it, you can tap it. Go ahead. Okay, there's another place right behind your back, or above your back, I should say. It's at C5. It's above the big bump on your cervical vertebrae. So reach up there and just massage that. You may find that one side of your vertebrae above the big bump protrudes a little bit more than the others off to one side or the other. So if that's happening, it may be interfering with the vagus nerve and its connections to the rest of the body. Here's some other things you can do. You can just simply tap or press in these areas. Why do we do that? Remember what we said about the brain and the gut, the intestines. The gut, by the way, is a legitimate medical term. All that area, if you push on there, or you can use the clinic in the case, the BMWs, the probes, the pads, and so on. And if you have such a device, if you want, email me and I'll be glad to send this to you, and you can help your vagus nerve. Okay. Okay, so make things happen, and tell you what, I've had a good time being with you all over the last few weeks, and does it say? Okay. And it's good being with you. I hope it helps.
Thank you.
Thank you.
Thank you
I'll
so much.
I'll see you all in the future, and hopefully I will not see you in the pasture.
Thank you very much.
Good night.
Good to see everyone. Thank you for joining us. Thanks again to very big thank you to John. Good night, everyone. And I'll keep you all posted on when our next one is coming up. And if you need to
Thank you
reach
for the
out to me,
Milovich.
thank you, John, very much.
Hey, John, John,
Yes.
I have a
I have an
question.
experience from the breathing technique that you talked about last week.
Okay.
We have a friend in our congregation who just lost her sister as a result of a really bad car accident. And she called me and said she didn't know what to do. She didn't think she could make it. And I didn't know what to